with the weather that we're getting into and that we've already experienced
Yeah.
already, what does this combo of heat and humidity do to the body?
Well, I think the excess humidity makes it even harder for us to stay cool. I think we're kind of spoiled in California in that we don't often face a lot of humidity. So it's easy to cool off. All we need to do is step into the shade and our bodies will start to cool down. But with humidity, we lose some of that ability.
But what are some things people can do to stay healthy when it's this humid and this hot?
So this makes me think of my big furry golden retriever. I think about her approach to the heat, and I think a lot of this is pretty common sense. We want to make sure that we're well hydrated, and that means water. It doesn't mean caffeine and alcohol. Those are dehydrating. So our choices in what we're drinking makes a big difference. So staying hydrated, number one. Staying cool. And again, that's common sense. If we don't have access to air conditioning where we live, we want to take advantage of a cooling center. In Sacramento County or Yolo County, I know we have lots of cooling centers available. And I want to encourage people also to not be afraid to take advantage of them. I know that's a concern with COVID. Some of us may be concerned about going into a space where other people are congregating. But I think that the counties have done a really good job of ensuring that there's going to be appropriate physical distancing, wear your mask, and that's a very safe choice. And one more tip about taking care of ourselves in the high heat is to rest. This isn't a time for great exertion. This is a time to take it easy. And if we are going to be exercising outdoors, I would choose to do that early in the day and to be very mindful of how much water we're consuming before and after.
And on that note, any other things to avoid when it's this warm?
For some people, we don't have the choice. We have to. Our work is outdoor work, so if that's something that we're doing because that's just the nature of our employment, I would encourage workers to pay close attention to the recommendations being made by Cal OSHA and by their employers, and take adequate rest breaks in the shade, to drink adequate water, and to make good choices about clothing. Apparel makes a very big difference when we're working outside in the heat, so you want to choose very lightweight, breathable fabrics to wear if you're going to be working outdoors or exercising outdoors.
If someone was experiencing just heat stroke, just like symptoms of heat exhaustion, what are recommendations for them to do or somebody around them to do if they notice that?
Heat-related illnesses are a spectrum of illnesses where maybe there's heat cramps at one end that are a bit milder. They can be painful, but they're less severe. And then we have heat exhaustion, where that might look like signs of fatigue, weakness, maybe dizziness. At its more extreme form, we can see nausea and vomiting. If someone you know is experiencing that, or you yourself are experiencing particularly nausea and vomiting associated with being out in the heat, that's time to seek medical advice. Then for heat stroke, which is at the far end of the heat-related illnesses, which is the most serious, that is a medical emergency. So if you see someone in that situation, you would call 911 immediately. So signs of heat stroke would be a loss of consciousness, fainting, confusion, also temperature greater than 103 degrees. Sometimes the skin can be very red and dry and not even look like it's sweating anymore. So if seeing someone in that condition, you would not hesitate. You would want to call 911 immediately. And you would want to put cold cloths on them. You wouldn't want to try to give them something to drink if they had an altered state of consciousness, though. I think particularly we might want to check up on our elderly neighbors. I know many of them have been self-isolating because of COVID, And if we could reach out to them by phone or even a knock at the door and make sure that they have their air conditioning on. And if they don't or can't afford to have their air conditioning on, to help them get to a cooler place and make sure they're taking care of themselves. I think it's particularly challenging to be elderly or have a chronic health condition that makes me want to isolate myself and protect myself from COVID, and then not take advantage of, say, going to Target, where the air conditioning, could be a great benefit.